Cyanide is a highly toxic chemical compound that consists of a carbon atom triple bonded to a nitrogen atom CN. It exists in various forms, including hydrogen cyanide HCN and sodium cyanide NaCN. Cyanide compounds interfere with cellular respiration by inhibiting the body's ability to use oxygen effectively, leading to severe health consequences. Sources: cyanide can be found naturally in certain plants, but it is also produced industrially for various applications, including metal processing, fumigation, and chemical manufacturing. Toxicity: cyanide is extremely toxic, and even small amounts can be lethal. It disrupts cellular function by inhibiting cytochrome C oxidase, a crucial enzyme in the electron transport chain of cellular respiration. Symptoms of poisoning: inhaling or ingesting cyanide can lead to symptoms such as rapid breathing, headache, dizziness, nausea, and confusion. Severe poisoning can result in loss of consciousness, respiratory failure, and cardiac arrest. Exposure: cyanide exposure can occur through inhalation, ingestion, or absorption through the skin. Certain industries, such as gold mining and metal extraction, pose a higher risk of cyanide exposure. Antidote: hydroxycobalamin is an antidote commonly used to treat cyanide poisoning. It forms a non-toxic compound with cyanide, allowing for safe elimination from the body. Safety measures: due to its toxicity, handling cyanide requires strict safety measures, and protective equipment is essential. Occupational exposure is regulated to minimize risks. Cyanide in nature: some plants, particularly those in the Rosaceae family, contain cyanogenic glycosides that release cyanide when damaged. Cassava, a staple food in some regions, also contains compounds that can release cyanide when consumed in large quantities. Given its high toxicity, cyanide poses significant risks to human health, and its use is strictly regulated. Emergency medical attention is crucial in cases of cyanide exposure, and appropriate safety precautions are necessary when working with or around cyanide-containing substances. Cyanide attacks the body's systems by interfering with cellular respiration, a critical process that involves the utilization of oxygen to generate energy in the form of adenosine triphosphate, ATP. Cyanide inhibits an enzyme called cytochrome C oxidase, which is a vital component of the electron transport chain in the mitochondria. Here's how cyanide disrupts the body's systems. 1. Cellular respiration inhibition. Cytochrome C oxidase is responsible for transferring electrons to oxygen during cellular respiration. Cyanide binds to this enzyme, preventing it from carrying out its normal function. As a result, cells are unable to utilize oxygen efficiently, disrupting the energy production process. 2. Hypoxia. With cytochrome C oxidase inhibited, oxygen cannot effectively participate in the electron transport chain. This leads to a condition known as hypoxia, where cells are deprived of oxygen despite its presence in the bloodstream. 3. ATP depletion. Since cellular respiration is impaired, the cells resort to anaerobic metabolism, which is less efficient and produces lactic acid as a byproduct. This process leads to reduced ATP production, the primary energy currency of cells. 4. Cellular damage. Inadequate energy production and the accumulation of toxic byproducts disrupt cellular function. Vital organs, especially those with high energy demands, like the brain and heart, are particularly vulnerable to cyanide-induced damage. 5. Systemic effects. Cyanide poisoning affects multiple body systems rapidly. Symptoms may include rapid breathing, headache, nausea, confusion, and, in severe cases, loss of consciousness, seizures, respiratory failure, and cardiac arrest. 6. Time sensitivity. Cyanide poisoning requires prompt medical intervention. The longer exposure persists without treatment, the more severe the consequences. Hydroxycobalamin is a common antidote that forms a non-toxic compound with cyanide, facilitating its elimination from the body. 7. Routes of exposure. Cyanide can enter the body through inhalation, ingestion, or skin absorption. Occupational exposure. Accidental ingestion of cyanide-containing substances, or deliberate poisoning are potential scenarios. Given the rapid onset and severity of cyanide toxicity, immediate medical attention is critical. Emergency treatment involves administering antidotes, supportive care, and addressing symptoms to enhance the chances of survival. Due to the potency of cyanide, preventive measures and safety protocols are essential in industries where there is a risk of exposure. Cyanide poisoning can manifest with various signs and symptoms, and the severity depends on the level of exposure. The onset can be rapid, and recognizing these indications is crucial for seeking immediate medical attention. Common signs and symptoms of cyanide poisoning include 1. Rapid breathing, tachypnea. Increased respiratory rate is an early symptom, reflecting the body's attempt to compensate for reduced oxygen utilization in cellular respiration. 2. Headache. Individuals may experience severe headaches, often one of the initial symptoms of cyanide poisoning. 3. Dizziness and confusion. Cyanide affects the central nervous system, leading to symptoms such as dizziness, confusion, and disorientation. 4. Nausea and vomiting. Gastrointestinal symptoms, including nausea and vomiting, can occur as a result of cyanide poisoning. Seizures. In more severe cases, cyanide toxicity can lead to seizures, which may be generalized or focal. 6. Loss of consciousness. Progressive cyanide poisoning can result in a loss of consciousness, sometimes leading to a coma. 7. Hypotension. Low blood pressure. Cyanide poisoning may cause a drop in blood pressure, leading to hypotension. 8. Cardiac arrhythmias. Severe cases may result in abnormal heart rhythms or arrhythmias, potentially leading to cardiac arrest. 9. Skin changes. Skin may appear flushed or cyanotic, bluish, reflecting the oxygen deprivation caused by cyanide's interference with cellular respiration. 10. Cherry red skin color. In some cases, individuals exposed to high levels of cyanide may exhibit a distinctive cherry red skin color, although this is not always present. It's important to note that symptoms can vary, and not all individuals exposed to cyanide will display every symptom. Additionally, rapid onset and progression are common in acute cyanide poisoning. Immediate medical attention is crucial if cyanide exposure is suspected, and emergency measures, including administering antidotes, should be initiated promptly. Prevention and safety measures in industries handling cyanide-containing substances are essential to minimize the risk of exposure. Cyanide exists in various forms, and it can be classified into different types based on its chemical structure and sources. Some common types of cyanide include 1. Hydrogen cyanide HN. This is a colorless, highly volatile liquid or gas with the characteristic bitter almond odor. It is a common form of cyanide and is used in various industrial processes. 2. Sodium cyanide. NaCN. Sodium cyanide is a white, crystalline solid that is widely used in the mining industry for gold extraction. It forms a soluble compound when dissolved in water. 3. Potassium cyanide KCN. Similar to sodium cyanide, potassium cyanide is a white, crystalline solid. It is used in gold mining and various chemical processes. 4. Calcium cyanide KCN2. This compound is a white, crystalline solid and is another source of cyanide used in certain chemical applications. 5. Cyanogen chloride CalCN. Cyanogen chloride is a toxic gas with a pungent odor. It can form when hydrogen cyanide comes into contact with certain chlorinating agents. 6. Cyanogen bromide Birkin. Cyanogen bromide is a chemical compound that contains both cyanide and bromine. It is used in certain chemical reactions. 7. Cyanide salts. Various metal cyanide salts can be formed by combining cyanide with metals. Examples include potassium cyanide KCN and sodium cyanide NaCN. 8. Cyanogenic glycosides. These are naturally occurring compounds found in certain plants that can release hydrogen cyanide when the plant tissue is damaged. Examples include amygdalin in bitter almonds and linamarin in cassava. It's important to note that while some forms of cyanide are naturally present in certain plants, others are synthetically produced for industrial purposes. Due to its high toxicity, handling and use of cyanide are strictly regulated, and safety measures are crucial to prevent accidental exposure. Mechanism of cyanide toxification. Cyanide toxicity primarily arises from its interference with cellular respiration, a fundamental process that takes place in the mitochondria of cells. The primary mechanism involves the inhibition of cytochrome C oxidase, a crucial enzyme in the electron transport chain. Here's an overview of the mechanism of cyanide toxicity. 1. Inhibition of cytochrome C oxidase. Normal cellular respiration in the electron transport chain. Electrons move through a series of protein complexes, ultimately reaching cytochrome C oxidase. This enzyme facilitates the transfer of electrons to oxygen, the final electron acceptor, to produce water. Cyanide binding. Cyanide binds to the ferric Fe3+ heme group of cytochrome C oxidase, preventing the transfer of electrons to oxygen. 2. Disruption of electron transport chain. Energy production halted. With cytochrome C oxidase inhibited, the electron transport chain is disrupted, and cells cannot efficiently utilize oxygen to generate energy through oxidative phosphorylation. ATP depletion. Cells resort to less efficient anaerobic metabolism, leading to a decrease in adenosine triphosphate ATP production, which is the primary energy currency of cells. 3. Tissue hypoxia. Oxygen deprivation. Cyanide's interference with cellular respiration leads to cellular hypoxia, where cells are deprived of oxygen despite its presence in the bloodstream. Lactic acid production. Anaerobic metabolism produces lactic acid as a byproduct, contributing to acidosis and further compromising cellular function. 4. Systemic effects. Central nervous system impact. The central nervous system is highly sensitive to oxygen deprivation. Cyanide toxicity can lead to symptoms such as confusion, dizziness, seizures, and loss of consciousness. Cardiovascular effects. Cyanide poisoning can cause a drop in blood pressure, hypotension, cardiac arrhythmias, and, in severe cases, cardiovascular collapse. 5. Cherry red skin color. Distinctive appearance. While not always present, some cases of severe cyanide poisoning may exhibit a cherry red skin color. This is attributed to increased venous oxygen content, despite tissue hypoxia. 6. Rapid onset and severity. Quick onset. Cyanide poisoning can lead to rapid and severe consequences due to the swift disruption of cellular respiration and energy production. Emergency medical intervention is critical in cases of cyanide exposure to initiate appropriate treatments, including administration of antidotes to counteract the toxic effects and enhance the elimination of cyanide from the body. Thank you for watching my video. Please subscribe my channel.